Hi, Kevin Henry of Dental Economics. We're the Liberty of the Seas from Royal Caribbean, and we're heading to Cozumel with Dr. Rhonda Savage and the Miles Global Team Appreciation Cruise. And we've been through day one of the Miles Global teaching, and Rhonda did a great job with it.
Thank you, Kevin.
And one of the things that stood out to me today was the fact that Rhonda believes, and correct me if I'm wrong when I say this,
Sure.
that if there's a difficult conversation to be had with the patient, it's really the doctor's responsibility to have that difficult conversation, not a team member, right?
That's correct, Kevin. I feel that the dentist is listened to differently in this situation, and the patient will treat the dentist differently. I have had a number of those conversations with patients that have just disrespected my staff. I've just talked all day. So disrespected my staff or are disrespecting our time, a flagrant disrespect of our time. And so I sat down with one of these patients who was a hygiene patient, and I said, Rosa, I think you're a wonderful patient, but I do have a concern. Now the most important thing to realize is anytime we have criticism, it should be private. We like praise and appreciation to be public, but any criticism should be private. So I did this with the patient one-on-one in the operatory. I call it a knee-to-knee discussion. Now, a great knee-to-knee discussion means that you and I are at a little bit of an angle to each other. If I was straight on with you, your knees, that would be a confrontational approach. So it's body language does matter, good eye contact, kindness, and respect in our voice. But this one patient named Rosa was continually canceling last minute for her hygiene appointment, and she was a good family. I mean, a good family of patients. I didn't want to lose the whole family. So I sat with her in this knee-to-knee position. I said, Rosa, and this was at a restorative appointment, I do need to share something with you. You've been canceling your hygiene appointments last minute, and that does concern me a lot because you're not getting the care you deserve. As well, other patients, because our hygienist is so popular, other patients aren't able to use Carrie's time also, so they're not getting the care that they deserve, and Carrie's on standby and waiting for you to come in. So it really impacts 3 people when you change last minute. So what I need to do is I need to ask you to put down a $50 non-refundable retainer to reserve Carrie's time. Will that be okay for you? Now, will that be okay for you gives the patient the out clause. If they don't want to, they can say no. The purpose of doing this as a doctor is the patient needs to understand the boundaries and the expectations that we have for the patient and their behavior, which is huge. See, bad behavior will continue as long as we allow it to continue. And these patients oftentimes are difficult people because they get what they want, they come in when they want, they pay when they want, and they disrespect us and they disrespect our team. So it's important that the doctor do be involved, and while this is never easy for anyone, I mean, it gives you the pit in your stomach, it's so important that the doctor step up to that leadership role. The second best option would be an office manager doing this or office administrator, but the doctor's words are just like gold. So I recommend the doctor step up. If you have a difficult patient who yells or screams at your staff on the phone, my staff had my permission to hang up, tell the patient, I'm sorry, I can't speak with you right now. The doctor will call within an hour. Hang up. Don't even let them say another word. And then my job was to call within the hour, and talk with them and try and resolve the issue. But then I always shared with the patient, which it didn't happen very often, but I would share with the patient, now, I do need to let you know that I consider my team to be an extension of myself. You treat me with professional respect, and I treat you with professional respect. I need you to extend the same professional courtesy to my team, or this relationship won't work out. And then the patient has a choice. See, you've created boundaries and expectations of their behavior. They now have a choice. If they cross the line again, they know that they'll be dismissed as a patient, or there will be a ramification for their behavior. If there's never a ramification for the behavior and we don't hold them accountable, the same behavior will continue. So I do believe it's important that the doctor be involved with difficult patients and difficult confrontational situations.
Good advice.
Great.
Thanks for your time. I appreciate it.
Thank you, Kevin. Appreciate it.